Good afternoon, everyone. I hope everyone's having a great day. I want to thank everyone for joining us today. My name is Troy Broussard. I'm with AARP, and we're very excited today to have Dr. Sarah McGinty with us. She's with the Mary Bird Perkins Cancer Center as part of their Prevention on the Go series. And on this Prevention on the Go series today, we're going to talk about something extremely important. Healthy skin is in. This is so important. This will be a great presentation that we're doing today. And after the presentation, Dr. McGinty, who's here with us live, will go ahead and provide us some additional information around it as well too. So we're very, very excited to have her here. And it's part of AARP's Healthy Living Social Mission. We are focused on improving healthy habits as we age. But I will have to share with everyone that content in this presentation program, including any advice, tools, handouts, or online websites, is provided for general informational purposes related to nutritional or medical condition and is not intended as medical advice, diagnosis, treatment, or a substitute for the medical advice of a physician. You should not use the information here for a diagnosis of health, nutrition, or a fitness problem or disease. Participants should always consult with a doctor or another health professional for advice or information about diagnosis or treatments. So now that I've mentioned this with everyone, it is my pleasure to go ahead and introduce Dr. Sarah McGinty. She's a board certified dermatologist. And Dr. McGinty, Sarah, it's a pleasure to meet you. How are you today?
Hi, I'm Dr. Sarah McGinty. I'm partnering with Mary Bird Perkins Cancer Center as part of the Prevention on the Go program. We bring cancer education and early detection to the workplace and to the community to help further our mission of improving survivorship and lessening the burden of cancer. It's nice to be here.
Awesome.
And I'm happy to answer any and all questions that you or any other participants might have.
Well, that's great. I'm pretty sure that we'll have some great questions. And the great part about this presentation today is that, first of all, I want to thank you for doing the video and for everyone that's attending and that will be watching us on YouTube after this is over. I want to let everyone know Dr. McGinty did a great job. You're going to enjoy this 18-minute, 19-minute video. It was well done with a lot of great information. And the cool part about it is that after this presentation, there's a couple of questions that she'll ask us as well. If we maybe missed it during the presentation, she'll be able to answer it afterwards. So I guess, Sarah, without any other further ado, I guess we're ready to go ahead and get this started. Are you ready?
Let's do it. I'm ready.
All right. Well, great. Well, let's go ahead and get it set up and hope everybody enjoys.
Hi, thank you for joining us today. I'm Sarah McGinty, board certified dermatologist, and I'm partnering today with Mary Bird Perkins Cancer Center to discuss some common skin concerns, including overall skin health and cancer prevention for adults. Cancer is a group of over 100 diseases characterized by uncontrolled growth and the spread of abnormal cells, which, if not controlled, can result in death. Gene mutations occur frequently during normal cell growth. However, cells contain a mechanism that recognizes when a mistake occurs and repairs the mistake. Occasionally, a mistake is missed. That could cause a cell to become cancerous. While we can't control our genes and the mutations that arise, we can control our exposures. According to the American Academy for Cancer Research, it's estimated that more than half of cancer deaths expected to occur in the United States this year will be related to preventable causes, including tobacco use, obesity, exposure to ultraviolet light, and vaccine-preventable infections. It's estimated that 1.9 million new cancer cases will be diagnosed in the United States this year. More than half of cancer deaths can be prevented. The American Cancer Society recommends 150 minutes of moderate activity per week to maintain a healthy lifestyle and to maintain a healthy weight. Regular self-exams are also an important part of cancer prevention. While early detection alone rarely prevents cancer, it can prevent cancer deaths. Family history and knowing your family history is also important, but it only accounts for about 5 to 10% of cancers. It's important to know what cancers run in your family so that you can ensure that you're regularly screened for those if you're at increased risk. Smoking accounts for about 30% of all cancer deaths in the United States, including about 80% of all lung cancer deaths. Lung cancer is the leading cause of cancer death in both men and women, and is one of the hardest cancers to treat. According to the American Cancer Society, in the United States, tobacco use is responsible for nearly 1 in 5 deaths. You can also get immunized to protect yourself from cancers, especially immunizations against hepatitis and HPV. And finally, protection from the sun's rays can help prevent many skin cancers that we see. You can do this by applying sunscreen of 30 SPF or greater and avoiding the sun's rays from peak hours between 10 a.m. and 4 p.m. And we'll talk more about that later in the presentation. More than 3.3 million people will be diagnosed with skin cancer in the United States this year. Over 100,000 of those will be diagnosed with melanoma. Although melanoma only accounts for about 1% of all skin cancers diagnosed, the vast majority of skin cancer deaths are due to melanoma. So what are the most common types of skin cancers we see? Basal cell carcinoma is the most common form of skin cancer seen in the United States and around the world. It's usually discovered in areas of exposed skin, such as the head, neck, arms, and back. It rarely spreads anywhere beyond the skin and is very rarely fatal. People at the highest risk for basal cell carcinoma are those with fair skin, blonde or red hair, and blue or green eyes. Squamous cell is the second most common type of skin cancer. It sometimes spreads to other parts of the body when left for long periods of time untreated. However, almost all cases are curable, especially if caught early. It rarely appears before age 50, and it encompasses the majority of skin cancers found in African American patients. Finally, melanoma accounts for less than 1% of skin cancer cases. It can develop in a new mole or in a pre-existing mole, and it causes the vast majority of skin cancer deaths. It happens to be one of the most common cancers in people younger than 30 years old. So who is at risk for these skin cancers? Anyone with a personal or family history of skin cancer, anyone with a history of abnormal or atypical moles, patients with increased number of moles, specifically more than 25 on the entire body, are also at increased risk for skin cancer, specifically melanoma. Patients with a history of excessive exposure to ultraviolet radiation, such as blistering sunburns or indoor tanning bed use. And finally, immunocompromised patients, such as transplant patients or patients that are on immunosuppressive medications for rheumatoid arthritis, psoriasis, or other diseases. This is an example of basal cell carcinoma. It typically presents as a pearly pink papule with prominent blood vessels. It may also appear as a red scaly patch or a scar-like lesion that develops on the head, neck, arms, or back. The numbers of basal cell and squamous cell carcinoma have increased over the years due to increased sun exposure and increased life expectancy. Here's another example of a basal cell carcinoma. As you can see, it presents as a flesh-colored bump on the back of the neck with prominent blood vessels. Sometimes you may notice these lesions bleeding easily from very minimal trauma or ulcerating and scabbing. These are examples of squamous cell carcinoma. As a reminder, if left for too long, these cancers may occasionally spread to other parts of the body, but the majority of cases are curable, especially when caught early. The common locations include head, neck, and backs of the hands. They typically appear as a rough, scaly bump or a sore that doesn't heal. Melanoma risk factors. Similar to other types of skin cancer, melanoma risk factors include increasing age, fair skin with blue eyes or red or blonde hair, and patients with more freckles. Also, patients with greater than 25 moles on their body are at increased risk for melanoma, or anyone with a history of a mole that was biopsied and came back abnormal or atypical. Personal history or family history of melanoma is also important, specifically 2 or more first-degree relatives with a history of melanoma, such as a mom, dad, or sibling. And of course, ultraviolet radiation exposure increases the risk for melanoma, including severe blistering sunburns, even as a child, and indoor tanning bed use. This slide has a diagram depicting the characteristics we look for in not only skin cancers, but mostly melanoma. We use the phrase the ABCDEs of melanoma to remind us what to look for. A is for asymmetry, and as you can see, this lesion cannot be folded onto itself to create a mirror image. B is for border irregularity. The color bleeds into the normal surrounding skin, and it's not smooth and well-defined. C is for color. Any lesion that has more than one color inside of a single lesion or presents with abnormal colors or unusual colors, such as gray, red, blue, or jet black. D is for diameter. Anything larger than 6 millimeters is of concern. And finally, E for evolution. Any lesion that's been evolving over weeks or months should be evaluated. Here's an example of a melanoma. As you can see, the lesion is asymmetric. If you drew a line horizontally and folded it over on itself, the two parts would not match up. The borders are irregular, and there are multiple colors present in this lesion. On the top, there's black and gray. The middle is lighter brown, and finally on the bottom is red. Here are 2 more examples of a melanoma. In the lesion on the left, you can see asymmetry, and the borders are irregular, almost impossible to define where the lesion starts and stops at the end. On the right, this lesion is also asymmetric with irregular borders, and it looks to be over 6 millimeters in diameter. Here's yet another example of a melanoma. This lesion shows asymmetry, irregular and ill-defined borders, variation in color, including light brown, dark brown, jet black, and gray, and the diameter is over 6 millimeters. The risk of melanoma increases as people age, and although it is one of the most common cancers found in patients under 30 years old, the average age of people when melanoma is diagnosed as a whole is 65 or greater. So what can we do to prevent these types of cancers? Well, here's a few tips for you to help improve your overall skin health in the coming years. First and foremost, avoid any indoor tanning bed use. When you're outside, especially during peak hours, use a hat to protect your head, ears, and neck. Apply SPF 30 or greater sunscreen to exposed skin. And wearing SPF clothing can minimize the sun's rays directly on the skin and minimize the amount of sunscreen that you may need to use. That includes long sleeve shirts and long pants. And finally, seek shade during those peak hours of sun exposure from 10 a.m. to 4 p.m. when possible. This slide discusses some important things when choosing a sunscreen. Most importantly is the SPF, or sun protection factor. The American Academy of Dermatology recommends SPF 30 or higher when applying a sunscreen for direct sun exposure. You should look for a sunscreen that is broad spectrum, meaning it protects the skin from both UVA and UVB rays, both of which can cause cancer. And finally, you want to look for a sunscreen that's water resistant or very water resistant for up to 40 or 80 minutes. Sunscreens that are not waterproof or sweat-proof should be reapplied after any exposure to water. And all sunscreens should be applied every 2 hours during sun exposure. The amount of sunscreen that you should apply should be about 1 ounce, or enough to fill a shot glass, in order to cover the exposed areas of the body. Use caution when choosing a spray sunscreen over a cream. The FDA is currently investigating the risks of accidental inhalation of spray sunscreens. There's also many challenges when applying these types of sunscreens, especially the fact that it's difficult to know if you've used enough to cover all of the sun-exposed areas on the body, which may result in inadequate coverage. Never spray a sunscreen near or around the face and mouth. Spraying adequate amounts of sunscreen onto the hands, then applying, can help you to avoid the fumes while also ensuring adequate coverage. When applying spray sunscreens on children, be aware of the direction of the wind to avoid inhalation. And finally, expiration dates are important. The FDA requires sunscreens to retain their original strength for at least 3 years. Most sunscreens do include an expiration date. If your sunscreen does not have an expiration date on the bottle, it's a good idea to go ahead and write the day that you purchased it onto it so that you can check back and discard after 3 years past the date of purchase. Another tip is to look for visible signs that your sunscreen may no longer be effective, such as obvious changes in the color or consistency of the product, meaning it might be time to get a new sunscreen. Here are some other concerns that we see frequently in mature skin. Seborrheic keratoses. These are very common benign growths with no malignant potential. Their incidence increases with age, and they may be treated by a dermatologist if painful, swollen, or itchy. Your dermatologist may decide to freeze these lesions with liquid nitrogen, to burn them with electrocautery, or to numb the area and remove surgically, depending on the location and the size. Here are some examples of seborrheic keratoses. You may have noticed these on your skin before or on family members. They're very common, and as you can see, they tend to have a light brown or flesh-colored color. They also sit elevated on the skin with a waxy texture, as opposed to the melanoma that we saw earlier with the multiple colors inside the lesion, asymmetry, and irregular borders. Dry skin is also a common complaint we see and may be preventable. The reason that dry skin occurs over the years is due to loss of natural moisturizing factors, decreased oil production, and decreased sweat production in the skin. Medications can also contribute to dry, itchy, irritated skin, especially lipid-lowering medications or cholesterol medications. We can help to soothe dry skin or avoid irritation to dry skin by applying moisturizers immediately after bathing, replacing your bar soap with an unscented, gentle cleanser, and avoiding prolonged hot showers. In general, we recommend showers to be 10 minutes or less and lukewarm in temperature. The longer your skin is exposed to overly hot water, the drier it may become. And finally, bruising or purpura is seen commonly and is a common concern to many of my patients. This happens as our skin ages due to loss of collagen and supporting connective tissue around the blood vessels, which happens over time as well as due to sun exposure. So you may notice this bruising is more common on the areas of skin that have been exposed to the sun over the years, such as your arms and backs of hands. Medications can also contribute to this, especially aspirin and blood thinners. There are certain diseases and disorders that can contribute to bruising that may be life-threatening. So you should always consult your doctor if your bruising becomes extremely painful or uncomfortable, if you notice bleeding gums, or if you notice blood in your urine or stool. That concludes our presentation. Thank you so much for your time and attention. And remember, if you have any skin concerns or new lesions that are growing, changing, or bleeding, please consult your local dermatologist for a skin screening today.
Hey, Sarah, we're back. Great job. Great information. I mean, I was listening the whole time. I was taking my own notes as well. So, but I do believe that we have a couple of questions that I would like to get to, if you don't mind. And
Sure.
I think it was one that I missed right at the beginning, but would you explain to the audience, explain your role with the Mary Bird Perkins Cancer Center? If you could share that, Mary Bird Perkins Cancer Center.
Sure. So I work as a private practice dermatologist most days of the week. On Thursdays, I partner separately with Mary Bird Perkins to provide these cancer screenings to the community and also to the workplace. So usually my typical day involves, treating patients with psoriasis, acne, rosacea, and seeing skin cancers, excising skin cancers in the office. But on Thursdays, I'm here on the bus checking patients at their workplace to see if they need any kind of dermatologic intervention and to catch these things early, because as you know, we all tend to put these screenings off. We put off our own health care, so it makes it easy for patients to have access to a free screening that may potentially save them and prevent the morbidity and mortality that can be associated with all types of cancer.
I think you hit on a very important part, that screening is so important. Taking the time on the front end to get screened, it's almost half of the effort needed to find a solution, because and most times you'll find that it's treatable in most cases, correct? For the most part, right? If caught early.
Absolutely. Almost all forms of skin cancer are curable if caught early. It's when they go on for years or, longer than that, sometimes many years, untreated, is when they can become more complicated and sometimes potentially result in a life-ending cancer.
Wow. No, it's great. Well, we have a couple other questions.
So that's why we encourage.
Go right ahead. I'm sorry, you encourage. I interrupted you. Go right ahead.
No, that's what I was going to say. We encourage everybody to get their screenings at least annually, so that they to empower themselves to know that they've been checked by a trained provider, and ensure that if they do have anything that is cause for concern, they get it addressed early rather than later.
Makes total sense. You know, I know you talked about it during the presentation, but could you talk about picking the right sunscreen? Could you talk about the SPF a bit? And also, I know there was some discussion that you had about the spray or the cream.
Sure.
If you could just talk
Sure.
about that and some that will we from a prevention standpoint.
Yeah, it can be overwhelming. There's so many products available now. When you go to the store, there's almost, multiple rows full of sunscreen. So the question is, which one do you choose? There's a few good rules to live by, and number one is SPF. So you want something that's 30 SPF or greater, at least 30 though. Anything below that, you're really getting you're still getting a lot of that UV dosage. So 30 or greater, that's number one. Number two is you want something that's broad spectrum, which means that it blocks all different kinds of UV radiation. So not only UVA rays, but UVB rays as well, because all the radiation that comes from the sun can be cancer causing. So you want something that's broad spectrum. That's important. And then finally, if you're going to be at the beach or at the pool or fishing or sweating, you want something that's water resistant, because I know we all try and be good about it, but it is hard to reapply every time you start sweating or get wet. So water resistance is also excellent. The last thing I get questions about is whether or not, or what about the chemicals in the sunscreen? People are concerned not only for their health, but also for the environment. And to address that, I typically tell patients to look for zinc or titanium as the main ingredients. Those are both what we refer to as physical blockers. So they're not going to be absorbed by the skin. They're not going to endanger any wildlife, but they're excellent. And actually, were the first developed sunscreens or sunblocks, and they still work great today. They used to be white and very opaque, but now technology has gotten so much more advanced that you can put them on and not have any trace or evidence of the sunscreen on your skin. And then I think you asked about the spray versus the cream.
Yes.
I typically in my household, and what I do advise all my patients is you always want to put a good base layer on first with the cream. Number one, because you're going to be able to see where you're applying it, and hopefully not miss any spots. Number two, the spray has, it tends to leave on a thinner layer, so you're still going to get a little bit more breakthrough exposure there. And finally, I think a lot of people worry about the aerosolized, not only alcohols, but propylene glycol that can irritate the skin. So sprays are great as touch-up. I typically recommend them great for touch-up on the beach. But the first layer, if you want to be protected, should be more of a cream lotion-based sunscreen.
Very, very, very good tips. I have not heard of the cream versus the spray. I've normally seen the sprays. So I like using a combination of both. Use the cream to cover the area, and then the spray to kind of, that way you're doubling the protection, which is very important. So
absolutely.
And we talked about sometimes, like with risk of breast cancer, can be evaluated normally through genetic testing. Can risk of any skin cancers be determined in a similar way? Just curious.
There is, so not the same as a blood test like you do for breast cancer.
Sure.
There are some newer technologies that are available where we can send genetic testing on specific skin lesions. And typically what that entails is there's a sticker that we put on the lesion that pulls off cells, and then we send that to a lab and they'll evaluate individual cells rather than cutting the skin and doing an entire biopsy. So it's yes and no, I guess I would say. It's a little bit different than the typical, blood screening like you can have for the breast cancer gene.
Okay, good. Look, all good questions. You know, we're trying to make sure that we touch on some high points from the presentation, which was excellently done, but we want to continue to share more information. So you did mention about a skin exam. How often would you recommend getting a skin exam with most
Sure.
individuals? Because again, we're all talking about early detection and prevention. So how often should we get it, and at what time
Absolutely.
should we do it? Go right ahead.
Right. I usually recommend at least once a year for everyone, kind of across the board. What age should you start? I would say, unless there's a very strong family history or any specific lesions that are of concern, adulthood, I would say, is when you should start to get those annual skin cancer screenings. Now, kids, we have kids come in the office all the time to get mole checks, and that's absolutely okay and fine. Typically, those are our patients that either have more, you know, a larger number of moles or a family history of abnormal moles. In general, pediatricians do an excellent job of screening for moles on kids that are growing. But once you turn 18, you should really strongly consider going to the dermatologist and having a skin exam at least once a year. The alternative to that is if you have a history already of skin cancer, your exams are going to be a little bit more frequent than that, sometimes every 3 to 6 months for those patients.
Very good. Okay, great. Well, I tell you what, the questions just keep, more information you provide, more questions. Like, I guess you get that a lot from your
Sure,
patients as well, too, right? That's great.
absolutely.
And, we talked about the different types of skin cancers, but, for the most part, are skin cancers treatable? Would you say that if caught early on?
Yeah, absolutely. If caught early, almost all skin cancers are treatable with a fairly, you know, less invasive type of procedure. So most of them can be treated by local excision, so just a surgery to remove the spot. Then rarely, if it's gone a little bit beyond the skin, it's going to be a more invasive type of procedure. But for the most part, if they're caught early and you're keeping up with those annual skin exams, yes, they're treatable and even curable.
Oh, great. And I'll ask this question. Are there some resources available online that you would recommend, resources that people can get educated on, as it relates to,
Sure,
skin cancer, and then some really credible
sure.
sources of resources?
I would, yeah, I would refer anybody to the American Academy of Dermatology website, or AAD. That's our licensing and credentialing office for board certified dermatologists. So it's essentially the American Board of Dermatology. Um, their website has a lot of information, helpful information for patients. So they have a whole area that's specifically targeted to patients and laypersons if they want more information or have questions. They even have, I do believe they have a tool on there that you can search your local area for a board certified dermatologist as well.
Great. Well, no, I tell you, you know, learning about this, I think it's extremely important. And I love that you have partnered with the Mary Bird Perkins Cancer Center to share this information, or like you mentioned, be on the bus, right? To do that and share that information
Right.
with folks here locally in the area. Sarah, I would just like for you to share, if you had to, share any additional information that we might have missed in the presentation and in these questions, what are a couple of things you would want to share with folks that are currently watching and those that will be watching on our YouTube channel? What are some things that you would like to share with, just some general rule of thumb, if you would like to, if we could say that, please, practices.
Sure, sure. I think the most important thing, and the thing that I try and, impress upon my patients, is that the sun is it's important to our life. It helps, it elevates mood. It's important for the plants. I don't by any means recommend people to stay out of the sun 100% of the time, or not go out and, go fishing, go camping, go to the beach. You should do all those things. Just protect yourself and make sure that you take the proper precautions. to, save your skin and hopefully prevent future, not only cancer diagnoses, but also painful procedures that it can sometimes result in if we're not so careful. The other thing that I think is important is that these habits, just like we learn to brush our teeth at a young age, once your children have those teeth coming in, you're brushing their teeth, you're bringing them to the dentist. The same thing goes for skincare and sun protection. So when you do go to the beach, make sure you put their sunscreen on and make them a part of it. And then that habit will essentially be adopted by them for the rest of their life. And I think that if we all, with the knowledge we have now, if we all start early and it becomes part of our normal routines, it won't be so hard to pick up the sunscreen and put it on before we go out and mow the yard, or do other things that are in the sun to protect ourselves.
Well said. Well said. What are those peak hours again that we really should make sure that we're protecting ourselves when we're out enjoying the sun? What are those peak hours during the day again that we really need to recover?
From 10 a.m. to 2 p.m.
Okay, good.
Right. From 10 a.m. to 2 p.m. are what we consider peak hours. So that's when you're going to get the most UV exposure during those times. And again, that tends to be like the most common time that you might be at the baseball park or be at the pool. And so wearing a hat, wearing sunglasses, putting on your sunscreen, and especially reapplying during those times can be helpful. Another, helpful tool that we have now is UV protective clothing. So I love the sun shirts and even pants, all sorts of protective gear that you can put on top of your skin and keep the sun's rays out by blocking it without having the exposure. To put sunscreen on makes it easier too. So having a sun shirt and a hat on hand can also add to protection during those hours.
Perfect. And again, what we should be looking for, I wrote it down, is UV protected clothing, right? We're not going to talk about any brands or anything, but UV protected clothing.
Right. Oh, you can find it anywhere. Oh yeah.
Good. But again, for all of our listeners, it's UV protected clothing. Again, like an additional layer of protection, right? Wow, this sounds great. I'm looking through to see if we have any other questions. Let me just check from our guests here. I don't see any questions in chat. I don't have any additional questions on my list. So that means, Sarah, you have done an absolute wonderful job. That's what that means. Okay. So you've answered all of our questions, and we want to thank you so much for being with us today, and for sharing your tips. And I know I'm taking away some things that between 10 a.m. and 2 p.m. I'm going to watch my direct sunlight, and if I am out there, I'll make sure I have some UV protected clothing on, a hat. Make sure, and if I do when I do put my sunscreen on, I'll try to do the paste as well as the spray to have that added protection. So I think I'm protected, and I hope that our listeners enjoy this as well. So any final words, Sarah, before we head out today?
No, I think you asked some great questions, and I think that the PowerPoint is fairly comprehensive. But I'm happy to be here. It's my pleasure. Thank you for having me.
Well, listen, we really appreciate your time to do the video, number one, and then to be here and have a very interactive conversation with us where we can share. So we want to thank you. Continue the great work here that you're doing here in the local Greater Baton Rouge community, and thank you so much. Have a great day. And for all folks that have joined us and will watch us on our YouTube channel, please have a safe day, and make sure that when you're out there enjoying all this wonderful sunlight, just make sure you're protected. Thank you, everyone. You have a great day. Take care. Goodbye.